Okay, welcome back, Greg Silberman, CIOs and Bow Ties. This is our final part, our part 3, with a really illuminating, fascinating discussion with Dr. Aubrey de Grey, Chief Science Officer of the Sense Research Foundation on health to live longer. There we go, I didn't say longevity. But let's just focus on two things. If there was anything that one could do right now to make sure, or not make sure, to increase the probability of getting to this longevity escape velocity, Doctor. I think two things came through in my readings and research of some of your publications, and that was around diet, specifically around sugar, and fasting, as they would say in the US. Can you make some comments about how you view those two aspects?
Yeah, they're both basically minimal. The amount that we can achieve by actually changing our diet or indeed our lifestyle is really small. And furthermore, exactly what one should do in terms of one's diet or lifestyle varies from one person to another. So actually, there is only one way to significantly increase one's probability of making the cut. And that is, write me a large check. Because at the end of the day, it's all about the time frame within which we actually develop therapies that do far, far more than what we can do today. And that's only going to happen if the therapies get developed soon. At the moment, we are in a much better situation than we were even 5 years ago, because a lot of the damage repair therapies that we need have progressed far enough that they have been able to be spun out into startup companies, not only companies coming out of Sense Research Foundation, but also literally way over 100 companies that have emerged independently of us, but aligned with us. And that's wonderful. But by definition, the damage repair approach is a divide and conquer approach, which means that every type of damage can kill you on its own, more or less on schedule, however well we fix all the others. And that means that the most difficult types of damage are just as vital as the others. And unfortunately, the most difficult types of damage are still at a sufficiently early stage in terms of developing therapies to eliminate them, that they are not yet investable. That's why Sense Research Foundation, which of course is a non-profit, a 501c3, that's why we still exist. Our goal is to get to the point where we can just declare victory and become purely an education and advocacy organization, because all of the research has graduated through to the private sector and is being pursued with far more money. But I mean, I'm really meaning the money, because the fact is, there are a lot of people out there who have deep pockets and who are visionary enough to understand that this is worth doing, but they fundamentally really don't like giving money away. So they just, they'll invest, and that's great. We will spin a project out of the company as soon as we possibly can, because it will immediately add like a whole digit to their budget, to the budget of the project. But it still means that the ones that are still within the foundation are suffering. So and this will slow things down. This will cost a lot of lives.
Okay.
So
let me interject there.
So I wish it were a joke that the best way to get things to happen is to write me a large check, but it's not a joke.
Okay. All right. Point taken. So, there is there's the research side of things, which I get, which is, unproven or is not really a for-profit situation. Excuse me a second. So I get that. But I think at the same time, as you said, there's a lot of people with a lot of money, and some of them are listening to you right now on our podcast. And, they'd like to invest in something where they can actually see a benefit financially out of it. So explain to us that pinnacle where you take something out of the research phase, or it's not really out of research, but where you can move it into the for-profit phase, raise money for it, put money behind it, and what is the investor actually getting?
Right. So yes. So the great news here is that investors come to me all the time to ask for advice on where to invest appropriately.
Mm-hmm.
And there are lots and lots of options. And they cover all the bases, whether someone wants to invest in a public company or in a completely new startup they want to put seed venture money in, or everything in between. And there are a lot of opportunities. The best way to describe it, I think, probably is that since we are talking about early stage work, the right way to invest is to take a lot of shots on goal, to invest small amounts in a lot of different places. But exactly which places, just diversify. The damage repair approach, the rejuvenation approach, is definitely the main place to be. The best way for a newcomer in this field to get involved is to get involved with other investors. And I do a lot of that, introducing investors to each other. There are whole networks, webinars that happen once a month that have, pitches from new companies. So there's a very much emerging community here. But the really important thing to understand from an investor perspective is how to calculate the risk-benefit ratio.
Mm-hmm.
In order to do that, one has to get a sense of how big this industry is going to become in the coming years. Because the bigger it's going to become, obviously the larger the eventual profits, and therefore the more justifiable it is to take a bigger risk early on. And what we're seeing is exactly that projects are succeeding in spinning out as companies, in other words, getting investment, even when they are still a couple of years away from even beginning clinical trials. That's pretty early. And moreover, when they're only a little bit further along, they're getting really insanely unprecedented amounts of money. I often like to talk about a particular company called Unity Biotechnology, which is one of the leaders in one of the areas I spoke about, the elimination of senescent cells. Unity is a great example because I can look at the numbers. So 2 years ago, they raised their Series A, and they raised more than $300 million. That's a lot of money.
Wow.
And it's the kind of money that biotech companies often raise when they are at the end of the process, when they are in phase 3 clinical trials. So they're, months away from actually having an approved product and getting actual revenue. This company, Unity, raised that kind of money before they had even begun their first phase 1 clinical trial. Completely unheard of. It just never happened. And the reason they did so was simply because the investors understood how big this sector is going to be quite soon. So yeah.
Well, it could also be symptomatic of just a lot of money flowing into a new idea. I mean, we've seen that before.
Well, yes,
many times.
I mean, the question is whether this is going to be a boom and bust thing. Of course, there's a certain degree of fashionability here. But the thing is, that's already happened. We've already been through that phase in this sector. 10 years ago, there were a few companies that came along where the science was not really ready, and in particular, where the founders of the companies didn't really understand how to talk to investors, so they took the wrong kind of money, more overly short-termist money, and the result is the company ended up being completely a waste of time. And everyone lost their money as well. But that's over. Both the scientists and the investor community understand that now. And of course, I understand that now, which is important because everybody comes to me for advice and for introduction. So, this is not going to happen again. This is now an absolutely ironclad, cast iron, secure sector. Of course, there will be companies that fail, and that's why I mentioned that the right way to go is to take a lot of shots on goal. But the sector overall, no way is it going to fail this time.
Yeah. Okay, let me just take it from one other perspective then, from the investment side, because obviously that's, we like protections when it comes to investments, and I'm assuming at this point in the cycle you're really investing in patents and IP, as it were. So I'll let you comment on that in 1 second. But my follow-on to this, and I've heard you actually say this on 1 or 2 interviews, the problem is so big and the solution is so valuable to mankind that at some point it really is a case of governments and world bodies, United Nations or whomever, taking it over and saying, listen, everyone is entitled. It's the discussion about whether a wealthy individual should be entitled to certain treatments, whereas somebody else doesn't get those treatments. And I think you said over time, I don't want to put words in your mouth, over time that kind of playing field gets leveled. So the question I have ultimately out of all that is, if the playing field does get leveled, what's in it for the early investor? How do they get protected by taking risk?
Okay, so that's actually a really easy question.
Oh, good.
Yeah. So, but the answer may be a little bit elaborate.
Okay.
So the first of all, actually, it's not quite that things will trickle down. Competition will cause costs to go down and all that, the way it is for most industries. And the reason it isn't like that is because people are seeing this coming. There will be a period of at least a decade, I believe, during which the therapies don't really exist, at least not in their full form, but yet everybody knows they're about to exist. And that's when the real, planning is going to happen, when policymakers, politicians, but also the private sector are going to be figuring out how to cope with it all. And at the end of the day, the money, the profit, is going to come from the mass adoption of this. There's only so many billionaires, right? So it's going to be in everybody's interests, the public, governments, and the private sector, to ensure that these therapies become available to everybody almost as soon as they are available to anybody. And the work that will go on before the therapies are available to anybody, because that's still in development, will be targeted in that direction. So then if we ask the question, how is it going to be beneficial to an early investor? It's no different than it is in any other sector. Early investors always take more risks, but they get more reward. They get more, multiplier because they were an early investor. It's going to be just the same as for any other sector.
Okay, I accept that as long as it's kept within the, the preserves of the market environment and the supply and demand.
Yeah, let me address that briefly.
Yeah.
Because of course one could imagine a kind of black swan situation in which there was some particular really essential component of this damage repair panel of interventions that was owned by a particular company, and it was being protectionist about it. It was trying to monopolize it. And then one could imagine a situation where this got, dirty, and government had to engage in, compulsory purchase of patents and so on, so as to preempt that and make sure that there was widespread availability of the technology. But in practice, we know perfectly well that it's never going to get to that point, because it's a negotiation. It's not a zero-sum game here. Ultimately, everyone wins if the thing is available. So there's a process of determining the happy medium there, how much public money would subsidize a therapy, how much, and eventually everyone wins.
Yeah, well, there's also that angle of public subsidies. I get it. Okay. Final question, Dr. de Grey. You've been very, very generous with your time, and I know you're a busy guy, so we certainly appreciate that. And this question is somewhat in, but mostly out of your field, but it's topical today, no doubt. I've coined this term super germs. It's my own term. You can use it or not, whatever it's not my. But we're dealing with this Wuhan Coronavirus right now, which has got everyone spooked. Obviously, it has the effect of shortening people's lives if left unchecked. So I just, what do you perceive? What do you see? What do you think when you see this happening in the world now?
What I see, and this, I actually first said this at TED back in 2006 or whatever. What I see is that progress that we make against aging is going to be empowering to humanity. It is going to help us to be less fatalistic about the other challenges that we have, whether it's pandemics, whether it's climate change, whether it's world peace, all of these things, right? We're going to feel that, okay, we solved the world's biggest problem. We could probably solve some of the others. Mm-hmm. And if we look specifically at the pandemic issue, the answer comes immediately. The fact is, right now, we are spending an absolutely scandalously small amount of money on vaccine development, the development of new antibiotics and so on. There are technologies out there that are totally ready to be developed that will completely transform the situation in that regard, whether it's with regard to new viruses like the Wuhan one, or whether it's with regard to multi-drug resistant bacteria, and the amount of money being spent on actually pushing that forward is it's just like unspeakably small.
Why is it?
Well, ultimately because not many of the policymakers in the Western world
are affected.
Exactly.
Yeah.
Whereas if we suddenly don't have aging anymore, then by
your politicians are affected. Yeah.
Well, right. By elimination, the remaining risks of death become more important, right?
Right.
And so I see this as being a way to actually stimulate.
Yeah. Terrific. Well, listen, this has been a phenomenal discussion from my perspective. I hope it's been somewhat interesting to you. I know a lot of it is repetitive from your side, but listen, we really appreciate having you on the podcast today. I'll leave you for any final words, contact details. We'll certainly put your contact details alongside this podcast when we post it. So thank you very much for taking the time out this morning. I wish you all the best and best of luck. I think you've undertaken a very noble undertaking, and I wish you all the best, and hopefully we all get to see the longevity escape velocity in our lifetime.
Well, thank you very much, Greg. It's been a delight to be on the show, and I very much hope that your audience has enjoyed and learned a bit from what I've been able to say. Thank you.
Okay. Real quick, some contact details, please.
Yeah, sure. I mean, the best thing to do is to go to SENS.org. S for sugar, E for elephant, N for November, S for sugar.org. This website is where we put everything. There's huge amounts of information there that is designed for every kind of audience, all the way from real expert biologists all the way down to complete novices. And of course, lots of information about the news, not only what we do, but what is going on elsewhere in the community. And of course, you can also, we have a contact form where you can write questions, and we also have a nice big friendly donate button.
Okay, terrific. And congrats to your boys at Liverpool.
Thank you.